I'm Diana Hodgins, I'm the CEO of Dynamic Metrics, and we have our system GaitSmart. This system was used in the Approach project to measure the patient's gait kinematics. It was used alongside the other measurements, the radiographic data and the patient's questionnaires particularly on pain and function. The system was used at month 0, month 6 and month 24. And that gave us the ability to understand how changes occurred over time and how they related to both the radiographic data and the patient's perception of their ability to perform certain functions. The data's been extremely useful to us and the consortia, and we've got 2 excellent papers out of it that show that the GaitSmart data both objectively provides data on the patient's ability to do things, their function, and to a lesser extent, but also apparent to their pain. And it also shows that it's more subtle, but follows the trend of the patient's perception of this over time. This is really important to all treatments for osteoarthritis because they need data that justifies the treatment. We learnt a lot in this trial, running 5 sites with 300 patients. There were things that we learned about the use of GaitSmart. When we used GaitSmart and it worked, there was some excellent data, but we did realise there was some difficulties with using the system that could be overcome. They were user issues that we could overcome. We did this in GaitSmart too. So there's a number of features that we have in our 2nd generation system, which is shown here, that are as a direct result of the Approach project. So this is the Gatesmart Report, and this tells you all the parameters on a person's gait kinematics, and this is what we've measured in the Approach project. So we've separated it out for ease to both the clinicians and the patients so they can understand it as easily as possible. The first score, the GaitSmart score, is the most important to people that are really struggling to walk. This is the fundamentals of the side movement of the hips and knees and the thighs and calves as segments. It tells you whether that person has the ability to walk correctly in relation to a healthy person. This is my report, so I'm fortunate that I'm all green, so you can't see the colour coding, but we do use amber and red, which tells you how far you are deviating from a normal, healthy person. Now, for the osteoarthritis of the knee, it would be the knee joint parameter that would change. This would go from amber to red, depending on the severity of the osteoarthritis. And this is a direct measurement of the person's ability to mend their knee when they're walking. The next score is the GaitSmart Quality Score. And we call it the Quality Score because it's an underlying problem that may hit you later on. So it tells you the out of plane movement, which is bad for any joints, and the loading flexion on the knees, the stance flexion. The stance flexion is an indicator of osteoarthritis. With somebody with earlier stages and late stages, they are unable to flex the knee joint when they load it. So this is a very important score for knee osteoarthritis. The Symmetry Score, which goes through each of the joints and segments, is really just a very quick and simple way of seeing, even if you're all greens, you may be out of symmetry, so your score may be less than 100%. And that's another flag that you need to look at.